If you want to better understand what's going on with healthcare, Digital Health Review is the podcast that brings relevancy into the health technology conversation. Digital Health Review presents stories of health equity and technology, as well as actionable advice and news at the intersection of digital health, public health, and health equity. I'm Blair Hurst, your resident Black health tech nerd and host. Dr. Mitzi Krockover is leader in the areas of women's health and women's issues through her work in investment, consulting, media, and entrepreneurship. As CEO and founder of Women Centered LLC, she has launched the Beyond the Paper Gown podcast, which aims to inform, inspire, and engage women to achieve optimal health. She is a partner at SSB Solutions, a healthcare management consulting, development, and investment firm where she focuses on women's health services. She's also a managing director of Golden Seeds, an angel investment organization dedicated to funding early-stage women-led companies. She is also a managing director of Golden Seeds, an angel investment organization dedicated to funding early-stage women-led companies. She serves as co-chair of the Golden Seeds Healthcare Sector Group and is a founding member and co-leader of the Arizona chapter of Golden Seeds. This episode was previously recorded prior to the recent Roe v. Wade Supreme Court decision. So there will be comments about the impending decision in this episode. But I wanted to take a moment to really acknowledge the importance of the conversation we're going to have, but also the importance of what is to come around women's health now more than ever. Let's get started.
But first of all, I just want to say, Mitzi, thanks so much for connecting today. I really appreciate this. I've been excited about having you on the podcast for so long. So thank you. So you and I, we met a while back, I think probably a little while ago. And since then, I've been following you and your work and what you're doing. Thoroughly impressed by all of it. And to know you are a physician by training. And you are also part of this growing number of folks who are now being called physicianpreneur. I don't know if you've heard of that. But physicians who are now sort of navigating that entrepreneur track, which I love. But I've always been curious about that transition. And so can you just share with me, a little bit more about your current work and how you got started in this area?
So yeah, I've had a lot of transitions from physician to corporate executive to investor to entrepreneur. And throughout all those transitions, my North Star has been women's health. That's been the thread that connects all of that. So I started out as a clinician, an internist, and was on faculty at UCLA School of Medicine, and had the opportunity to design and direct the Iris Cantor UCLA Women's Health Center, where we reimagined a way to deliver gender-focused healthcare to women. And we also, taught medical students, residents, and even faculty. We were designated a Center of Excellence in Women's Health by the Department of Health and Human Services. And then I had the opportunity to lead the women's health effort at Humana as Vice President of Women's Health. So I found myself as a corporate executive, and my role was later actually expanded to preventive services and what was then a nascent e-health initiative as well. So that was a great opportunity for me to get a view on that. And then fast forward about, 4 or 5 years ago, I had a few women's health companies asked me for my clinical expertise. And, I saw these women that had identified their own pain points, did not find an answer in the marketplace, if you will, to solve them. So they decided to solve their own pain points through innovation and entrepreneurship. And I thought, this is the next way that we're going to move the needle. And I literally wanted to be invested in it, and was introduced to Golden Seeds, which is an angel investment organization So again, got into the investment piece to fill those gaps that I still see in women's health, one of which is an education gap, especially for women over 40.
You just spoke on an incredible amount of work that has benefited women, is focused on women, women's health, the future of women's health, which I think is extremely amazing and needed. And I'm curious. It seems as though, from what I'm pulling from what you just said, was that part of your work is investing in women founders, especially those that are building women health focused companies. Is this your thesis as an angel investor from your previous experience, or is this something that you come to through just general experience and networking with founders, working with colleagues? Are you pretty firm on that thesis?
Yeah, when I first came to, as I said, to Golden Seeds, my focus was just on women's health, or that was, the reason why I joined. And what I've been able to do is not only see women's health companies, but other health and life science companies, as well as, the sectors of consumer goods and products, as well as enterprise and SaaS. And so, it's opened up a whole new world for me. And the thread for Golden Seeds is that we invest in women-led companies. And what that means is that they don't have to necessarily be founded by women, but women do need to have a leadership position and an equity position, and value system that we need to be supportive of women and diverse teams in general.
Yeah, yeah, absolutely. And I love that part of your thesis too is not that it has to be founded by women, but women have to have a substantial equity stake. I feel like this is a separate conversation that we need to have with Sally from Elvest, because
Yes.
financial literacy is so tied to health equity, and equal rights, especially for women. And so that equity stake, I think, is definitely a very interesting and good part of your thesis there. But it's curious too, because on one end, you have a very well thought out and well planned, and I would agree, pretty good thesis around, women having good results, starting and funding and making companies profitable, right? So that's your thesis hat, right? I mean, so that's your
Sure.
investor's hat, your thesis hat around angel investing. But at the same time, you are also going out and you're building these companies, or you're helping to build these companies.
Mhm.
So there's an entrepreneurial part to you as well, especially with you starting beyond the paper gown, the podcast. So I'm wondering for you, like, what do you feel is the real distinction or the relationship distinction between those two roles?
In terms of investor and entrepreneur?
Yeah.
Yeah, no, that's a really great question. And I was happy to kind of ponder that. And I guess I am an entrepreneur, but I don't feel like I've earned my wings yet, because I haven't gone out to fundraise. I think that's when you really earn your stripes, if you will, as a member. But I'm very respectful of entrepreneurs, having been an investor now, because I see how hard they work. And, having to fundraise is a grind, and having to, again, answer this probably the same questions over and over again and show up. And being an investor, I know what the questions are at the end of the day they're going to be asked. My investor hat really plays into my work as an entrepreneur.
Yeah, it sounds like in some ways, even though you're saying you haven't raised funding, you don't feel, like a full entrepreneur, that the work that you have done and that has been entrepreneurial has maybe made you a little bit more empathetic as an investor, but also probably a little bit more rigorous as an
Yes.
entrepreneur, because you know what investors are looking for. So that's
Sure.
great knowledge. I hear all the time, because I've just joined Twitter in 2022, but I hear all the
Welcome.
time that investors that have been founders are the best investors to work with, because they will still be rigorous, but they are also highly empathetic to the journey of founders, and also very helpful on that journey, rather than just being sort of gatekeepers and critiquers. So that's good to hear that you have like both sides of that paradigm, and it makes a lot of sense. So I know you are the type of person that likes to wear many hats, obviously. I'm curious, what are you working on next? What's coming up for you?
Well, as you mentioned, we're honing the podcast beyond the paper gown. It's now a part of the Off Script Health Media Network, so I'm real excited about that. And we're starting to build a community around the topics that we are focused on so that women can have a place to talk about these issues and a resource for their questions. Interestingly, I've had a few men say, I really enjoy listening and learning more as well. So I guess I shouldn't really just, limit it to just women, but we certainly want to have a safe space as well. And shameless plugs that the podcast is available on our website at beyondthepapergown.com. So I hope you don't mind that, as well as all the podcast platforms. And as I said, we're starting the design for the women's health centers, and looking forward to rolling that out as soon as possible, because the need is there. And, we also live in this very turbulent world and can't turn off the fact that there's so much going on, including that women's health rights are being threatened, not just for me, but for my daughters and their friends. And obviously, I'm talking about the impending Roe v. Wade decision. And I should say that this decision and this whole issue illustrates what I'm trying to do at Beyond the Paper Gown, which is showing the effects on health and people through policies and legislation. And in this case, the effects are far reaching. And we know that, for example, it's not just about reproductive rights and health, but it may be the individual rights. And it may be about the entrepreneurs that I work with who are developing apps and products for women and having to understand, the privacy implications, and women's health businesses are losing investment. And, even employers are trying to decide how they protect their, female employees. So I'm seeing all of this, I'm living all this, and find myself being frustrated and yes, angry, and thinking, well, okay, what can I do about it? And I thought, okay, I have this platform, so why not use it? And so decided that we were going to produce a webinar that will look at all of these issues, about the implications, and we called it, aftershocks, the implications of the Roe v. Wade decision. And I thought, okay, who can I bring on the panel to talk about some of these issues? And, God bless you. You were one of the first people I called because of your expertise in digital health and privacy and equity. And thank you so much for saying yes immediately. And we have so many other panelists also jumping on board. And so that's right now my focus until July 6th, which is when the webinar is going to be.
Yeah, that was a lot, and I love the shameless plugs, and I'll put I'll put in a shameless plug myself. A lot of the things that you were talking about are essentially why also we have, yes, the Digital Health Review podcast, talking to innovators and leaders in the field like yourself, but we also on the website source those articles and content around policy and regulation, and around public health, and around research, and around digital health, because it's extremely important that folks, one, understand what's happening, and we're trying to create that thread between digital health, public health, and health equity. But two, once informed, feel empowered to have some level of action towards what they want to see, or how they want to see their world enacted. And so, this decision is very scary. I also have a daughter. I also have two sons, and there's implications for men as well.
Of course.
And one of the things that I think is going to hit the digital health community a lot is this decision. And I don't think that it's just limited to women's health.
Yes.
There is a large amount of digital health companies that are using telehealth to expand access to mental health, right?
Yes.
Which is
Exactly.
great. And much of what is said to a therapist is supposed to stay within the conversation and within that protection of that therapist. But as we all know, if a therapist feels like you're going to harm yourself or someone else, by law, they are then required to disclose that. And so, if we are getting ourselves closer into a world where we are no longer feeling safe to even just talk about what's happening to our bodies and what's happening to us, that threat, that, and I kind of want to call it, this sort of alternative world is what I want to leave it at.
Yes.
that alternative world is very scary and something that we need to really sink our teeth in and to really make sure we understand where we're headed and to make sure that people understand what options they have for themselves, those who want to protect women and women's health and women's rights, what options they have. And so outside of that sort of tangential rant, I'm excited for this aftershocks conversations. We have folks from data privacy, we have folks around healthcare privacy, we have sort of news correspondents, we have digital health founders themselves, we have digital health experts as well, coming together to talk about this and putting our minds together around this issue, and obviously receiving questions from the audience that is attending. So second shameless plug, you guys should all join that, and I'll leave the link to that event in the show notes. But this is a very big issue, and I think what you're doing as far as not being angry by yourself, but putting together the minds that have an opportunity to collectively come up with solutions is the right way to go. And I think that's a skill that needs to be exercised. But also something that, personally myself and at Digital Health Review, what we're trying to foster a little bit more is breaking down those silos between the sectors and getting everyone to build together, because policy and regulation have far-reaching implications, but policy and regulation also can be controlled by the individual person in their community, which also, as a fun fact, the AMA has recently acknowledged that voting is a social determinant of health. So our ability to choose what type of legislation is impacting our health is part of our health care. So I'm gonna end that rant there, because I'm gonna go on and not stop.
Thank you for joining us. If you'd like to subscribe to our newsletter, shop the latest digital health products, or listen to more episodes, please go to www.digitalhealthreview.com.